India on high alert, preparing for a possible COVID-19 surge as the virus drives up cases in China and the rest of the world. The country is planning to make negative test reports mandatory for passengers arriving from countries with high infection numbers. It comes after the National Health Ministry held a meeting on the situation earlier and is expected to issue an advisory ahead of the festive season. India will be conducting mock drills to test emergency preparedness at hospitals across the country starting Tuesday. The use of masks are now mandated in different states, as well as social distancing on flights and at airports. Meanwhile, a needle-free intranasal COVID-19 vaccine has been approved by the government as a booster dose for those aged 18 and above. India has reported 185 new infections today, taking the total number of cases to more than 44 million. Active cases have declined to 3,402. Only one virus-related death has been reported in the last 24 hours. Nia Punya joins us live from New Delhi with more. Nia, what is the significance of the timing of the drills that the government plans to hold at hospitals, and how different are precautionary measures this time round?
Well, the government is clearly trying to strike a balance between ensuring that the systems are ready to go while making sure that there isn't any panic on the ground and that it isn't issuing any directives that could impact supply chains, mobility, as well as the daily lives of people. We're seeing the government not issue any pan-India directive this time around, very unlike what we saw at the start of the pandemic when a harsh lockdown really brought the entire country to its knees. This time around, the government has suggested that people mask up in crowded places, but some states, like you said, have made that mandatory, particularly Karnataka. It's saying anyone who is going outdoors to places that are closed will have to be masked up mandatorily. The government also saying that it will start testing randomly international passengers coming in to all of the airports, picking 2% of all the passengers from a particular flight. But again, some states are differing on that count. Tamil Nadu, for example, saying it will screen all passengers flying into the state. But the focus of the government really is to ensure that hospitals are ready to ensure that there's no shortage of critical resources, much like what we're seeing in China right now and much like what happened in India during the second wave. So the mock drills will focus on ensuring that there is enough preparedness on the ground, that there are enough beds, isolation facilities, tests, oxygen cylinders, ventilators, and also staff in case there is a big surge in cases. So hospitals are going to try and run a mock drill to act as if there is a surge in cases to see how well these systems run in an eventuality like that. The government says there's no need to panic, but it does want to be more prepared. Something very different from the last few waves we've seen, where the government's response was entirely reactionary.
All right, many thanks, Nia Punya, reporting there from New Delhi.